Well, it's been a few weeks now since we last spoke to our medical officer of health, Dr. Janet DeMille. Since then, children have returned to school, vaccine passports have come into effect, there was an election that was marked by protests over vaccine mandates, and it's been more than a month since our border reopened to vaccinated Americans. With all of that going on, we decided it was time to check in with Dr. DeMille again, and she joins me now. Dr. DeMille, good morning.
Good morning, Amy.
Well, welcome back to the program. A lot has happened.
It does seem like a lot has, yes.
When you look at our numbers here in Thunder Bay right now, things are looking good. Only, I believe, 2 active cases in our district right now. How are you feeling? Are you feeling pretty safe at this point, or do you worry about heading into the fall?
So I think it's probably an occupational hazard of mine that I always worry. I do agree, though, we're in a very good situation right now, both on having really low COVID rates right now, but also a fairly high immunization rate, and that's still going up. That's both 2 big factors that are very reassuring as we approach the fall and the winter. I think at the same time, though, it is an uncomfortable time. We see numbers going up, and elsewhere, the modeling is still not looking very good, even for Ontario, even though there's been some stabilization over the last week. And, school is back in, other more indoor activities will be happening, and that will increase our risk overall.
Mm-hmm. And when you look at the cases that we have been seeing lately, what can you tell me about those cases? For one thing, how dominant is the Delta variant here?
I think that all our cases recently have been the Delta variant. It does take time to get the mutation pattern, which would help us decide if it's Delta or not. And not all our samples are going through the full whole genome sequencing, which would confirm which variant it is. But it is showing the mutation pattern of the Delta variant, and that we get that test around 2 to 4 days after there's a positive test, and all of them are showing it looks like Delta. And that's really consistent with what's happening across the province and even across the country. I think it's almost 99% of all cases in Ontario are the Delta variant or presumed to be the Delta variant.
Mm-hmm. And are we seeing any signs of spread that goes beyond close contacts?
Not really at this time, or nothing of significance. And we're seeing sometimes it's a very close contact, like use often the household contact that is, where we're seeing some transmission, and that's in some ways not that surprising. But right now, no, it looks very controlled. Of course, our tests that we get now and the results that we get now reflect what happened a week ago or even 2 weeks ago. So if there was spread that was happening last week or, late last week or over the last weekend, we wouldn't necessarily be picking that up right now.
Why do you think we haven't seen, given that we know how fast that Delta variant, how easily it can spread, why do you think we haven't seen it take off in the way some other parts of the country have?
Well, there's a number of reasons for that. I think that, we had public health measures sort of maintained right through the summer. The government did take a cautious approach to the reopening, and in fact didn't fully reopen as it had originally planned in August, as we moved through those steps. And so there's still those public health measures, including the masking, especially indoors. I think that's likely worked on our side, as well as, the vaccination rate. I have to say, every time I look at the effectiveness data on the vaccine, and we're starting to see more of that data as it relates to Delta as opposed to the previous variants that were there, it really shows that the vaccines work, especially around hospitalizations and ICU admission, but they've maintained, have still a very good effectiveness at preventing cases as well. So somebody who's fully vaccinated that, is there's 85 to 90% effectiveness against getting a symptomatic infection with the Delta variant. So, and we know that we have very good immunization rates here.
As you say, the immunization rates in our district are good, especially good when I look at the breakdown for kind of that 50 plus age group. Not quite as high for some of the younger demographics. I'm looking at the 30 to 39-year-old a little bit lower. What do you think is going on there, and how do you reach those demographics that don't have as high of a vaccination rate?
Yeah. So we use sort of two sources of data that we have to look at the vaccination rates over the over the different ages, and we have been monitoring them on both sources. There's always challenges calculating, so we like to use two different sources. And I think what's most reassuring to me is that those numbers are continuing to go up. I mean, almost every day, but certainly every week, every age group, first and second doses are going up. And so we're seeing greater uptake, and those, the younger age groups, I mean, where they sort of started later, I guess, in terms of their eligibility, but we are seeing those numbers go up, and I think perhaps as we got into September, even more people were coming forward to get those doses, and those numbers will go up. So, and there might be a sense of people may not be, younger folks may not be as worried or as concerned about COVID because they've generally done better even before the vaccine. However, with the Delta variant, that does look a little bit different. So we do encourage everybody who's eligible to get vaccinated and get both doses. It's really both doses that are needed on the Delta. And certainly, the youth, I think the youth 12 to 17 are the ones that have the lowest coverage rates, but that's the number that continues to go up. So, and I would certainly encourage any youth of that age group to come, to get their vaccination, both first and second doses, and we know a lot have.
The province's vaccine passport system came into effect yesterday. Yep. In the run up to that, did you see a bump in our vaccination rate in response to that announcement in our district?
Yeah, so it's interesting. Since the beginning of August, we've been, delivering almost a similar amount of overall number of doses per week, and it's been, fairly steady and, fairly consistent in that, and that's what's keeping our numbers going up. About 3 weeks ago, though, I think that was around the time the vaccine passport was announced. We did see a fairly significant increase in the number of people coming forward for their first dose, so those who hadn't received any previous immunizations. And that has been maintained over the last number of weeks. So we are seeing people come in for their first dose. It's been close to 50%, but maybe it's now sort of around 40% first doses, but still maintaining, and then the rest being second doses. And then third doses that we're giving are over on top of that. But we are seeing people still come forward for immunization.
And the third doses, I take it those would be for people who are immunocompromised. Can you tell us more about that and what the uptake has been like? It is primarily for those who are immunocompromised, and it also includes individuals in long-term care home facilities and some associated facilities there, just because of the older age and the fact that those individuals really received vaccination way back in February as their first dose, and just concerned about a little bit of a waning of immunity, and so boosting that up with a third dose. So we are seeing an uptake of that, especially last week and this week, and working with healthcare to make sure that people who are aware, who have one of the criteria for being immunocompromised or immunosuppressed, that they come forward and get immunized. If we could go back to the vaccine passports for a minute, I also wanted to ask you, we have seen across the country some resistance to the idea of vaccine passports. We know that some businesses are worried about how patrons might respond. What are you hearing here in Thunder Bay?
So I think for the most part, We've had a lot of people come forward for immunization and who are fully immunized. And I think there's a lot of support for vaccine passports. And, I know there's some challenges around the implementation, and there's so many businesses that have to do it, and everyone can be a little bit different in how it applies. And so there is a challenge with the implementation, and I appreciate all the work that's going into that. And it should get easier, especially when we have those QR codes. And I appreciate overall that it's, some people may feel a resistance, and some say that are quite strong around the idea that there needs to be passports. And some of that is, fairly flagrant misinformation that's out there around some people who are opposed to that. But I do appreciate, though, that, we wouldn't normally do this, obviously expect people to meet certain criteria before going into different settings. But in the context of this pandemic, and in the context of the Delta variant, and as we get into the fall and the winter, we are at risk, and these settings are at risk where people go in, and whether you talk about a gym facility, like a recreational facility, when we're indoors, and that risk, unfortunately, is going to be largely driven by people who aren't vaccinated. And so this passports is a way of kind of excluding that, and an important measure in the context of this pandemic.
We're just about out of time, Dr. DeMille. But I mean, another big change we've seen recently was the border reopening to vaccinated Americans. How do you feel it's gone?
So I think it's gone reasonably well. I appreciate that there is, they have to be vaccinated and a test, and I think that helps. I'm always uncomfortable when I look at some of the data from the states, including from Minnesota, that there are high rates of COVID there, and we know that even somebody who's fully vaccinated can be, coming across the border with COVID, even, depending on the window when they had their test done. To be honest, I'm actually more concerned about travel really within Canada, especially from out west. So what we see happening notably in Alberta and Saskatchewan, but also even BC, we know that some of our cases, we know that some of our residents here and have traveled to those areas and brought that back. And we know that there's a lot of people from different parts of Canada who come into our area to work. And they certainly could be bringing COVID with them when they do that. So that remains a concern, of course, and just encourage people to protect themselves here from further spread by getting immunized, and certainly if people are coming in to our area, just to be cautious and take those precautions.
What would your recommendation be around travel? Would you recommend that people avoid it if they can? Our travel recommendations are, if you need to travel, especially if you need to travel, or just get immunized, be fully immunized. That is hugely protective, regardless of where you go. If you're 2 weeks past the second dose and are fully immunized, but be aware of the COVID situation where you're going, so that and then take the appropriate precautions when you're there and when you return. And certainly a big thing for people when they return is if they have symptoms, just isolate and get tested. Dr. DeMille, as always, really appreciate your time this morning. Thank you for joining us.
Thank you very much, Amy.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District.